I know that you hate burpees.
Yes.
Why?
So here's what I'll say. If you are training at home and you have no other equipment and you want to do burpees to get movement in, fine. No problem. My issue with burpees is, number one, as my good friend Ben Bruno says, it's an advanced exercise masquerading as a basic exercise, beginner exercise. It's not a beginner exercise. And I see beginners are being forced to do it all the time. It's actually a very high level exercise.
Yeah.
And people are, when you see people doing it, they're like, they're flopping all over the place. They're using terrible form. If we break it down, a burpee should be a good squat followed by a good push-up. But when you program them 50, 75, 100 at a time, technique breaks down, people get injured doing it, and you're not actually making progress. You're not getting stronger, you're not using good technique, and that's where I have the biggest issue. The other issue is that a lot of coaches, and this is what people who aren't coaches don't understand, they put a burpee in there when they don't know what else to do. A burpee is a filler. It's a placeholder. And they'll do it because it's going to make you tired. Mm-hmm. And a lot of people think, oh, if I'm tired, my coach is good. Anybody can make you tired. Do 100 burpees. There you go. You're fucking tired.
Yeah.
Right? Go run around the mall. You're tired. Go whatever. It's not hard to make someone tired. It's difficult to make them better, to actually get real results. And a lot of people, they have this idea, like I've heard so many people say, oh, my coach is amazing. I throw up after I work out. My coach is amazing. I'm so sore. My coach is amazing. I feel dead. I'm like, why is that amazing? It's not hard to do any of that. Have you gotten stronger? Have you built more muscle? Have you lost body fat? Are your clothes fitting better? Like, are you lifting heavier weights? These are real progress markers. Soreness isn't hard. Do 100 burpees. You'll be fucking sore tomorrow. Doesn't make you better. And so burpees are an easy way for a coach to make it seem like you're doing something when in reality it's just a placeholder filler instead of doing something that's actually going to help you make progress. I would rather someone, instead of doing burpees, just do really good squats. Instead of doing 100 burpees, how about we do like 5 sets of 5 really good squats and then 5 sets of 5 really good push-ups. You got 25 of each, and we can actually focus on progressively overloading them, making them more of a strength exercise rather than just flopping around like a fish. Like, let's focus on making it really well done with good intent rather than trying to just get you tired for the sake of being tired.
Yeah, no, that's really good. Because I think there's a big misconception, like you said, that if you're not sweaty, you're not working hard enough.
Correct.
If you're not sore the next day, you're not working hard enough. And I think it was you who said, like, if you're not sore, that's okay. Because you still want to do things.
Correct.
Like, you still want to pick up my kids and, like, hug them and, like, be able to move around and do things the next day and not be, like, lying in bed like a lame duck, you know?
If you're so sore that it's preventing you from getting another workout in, you work too hard.
Yeah.
Your volume was out of control. Your intensity was out of control. You shouldn't be so sore that you can't work out. Soreness isn't a bad thing. It's not an illness. Like, it's normal. But you shouldn't be so sore that it's affecting your ability to live your daily life or get another workout in.
How do you determine your intensity? Like, how do you know when you've reached your max effort?
It's a wonderful question. And there are many ways to do it. There are ways that I would prescribe more for an advanced lifter, and there are ways that I would prescribe more for an average everyday person. For an advanced lifter, I won't go into too much detail, but there's actual use percentages. So you find your max on a given movement. You test it. There's a whole protocol for doing it. You figure out what your max is for that movement. And it's sort of an intense, difficult process. And then throughout your training, you have a percentage that you work off. So let's say you deadlifted, 400 pounds. And like, okay, so we're going to work off that percentage. So we're going to do like 70% for 3 sets of 5 reps on week 1. Then we're going to do 73.5% for week 2. Then we're going to do 75% week 3. And you literally do it from a mathematical perspective, which there are pros and cons to it. And that's more for an advanced population. For the average everyday individual, I prefer something that's called RPE, rate of perceived exertion. It's a learning curve, but essentially it's on a 0 to 10 scale. And the way I think about it is like 10, you couldn't do another rep. Like 10 is like with a gun to your head, that was the last rep you could have done. And oftentimes a 10 means like your form started to break down a little bit. Like that was like your max effort. 9 reps, you might be able to get one more rep with a gun to your head, maybe. 8 is now where it's like maybe you had another rep, maybe 2 in there. And so you go down like that. And then generally, I like to have people between like a 6.5 to an 8, generally speaking. And it depends on the day. If they're feeling really good, maybe they're at an 8, 8.5, 9 on one day. But if they're feeling bad, maybe they got laid off their job, stress is really high, maybe they're at like a 6, 6.5, and that's totally fine. As long as you're in that range, that 6, 6.5 to like 8 range, your intensity is high enough.
And you're going to see progress.
You will see progress.
Even if it's a 6.
Correct.
Okay.
And
so you don't have to go to failure every time.
No, it's no. Failure is not bad, and occasionally going to failure is fine. But if you're going to failure every single time on every exercise, like it's a recipe for disaster.
You're going to hurt yourself.
Not even necessarily hurt it's a higher risk.
Yeah.
For sure. But the strain mentally and emotionally of going to failure it's taxing on your central nervous system. Emotionally, like people think they go to if you are truly going to failure, it's a devastating workout. Yeah. Over and over. Like it's devastating. So, and there are benefits to occasionally doing it. It's so funny. Like people think that you have to go to failure. Talk to an elite athlete. Talk to an Olympian. Talk to a professional athlete. Ask them how often they train to true failure. And I guarantee you they will say very rarely. Like definitely not every workout. And it's funny because these average everyday gym goers think that they have to be training to failure every time. It's like, where the fuck did you come up with that? It's made up, and it's going to cause more harm than good. And I'm hesitant to say it's definitely going to cause injury just because we don't know definitively what is going to cause an injury, right. But it's way more likely. And my concern is you're more likely to burn out and not go to the gym at all. If you think that you have to keep doing that. Like if I'm having a bad day or I'm really tired, and in my mind I was like, I have to train to failure, I'm probably just not going to work out. Yeah. If I think it's just not going to make progress, it's like, listen, sometimes an RPE 8 might be one weight, and then the next week an RPE 6 might be that same weight. But then it could also be reversed. Mm-hmm. Going by RPE makes it less about the weight and more about how you're actually feeling that day, which is what I like about it. Yeah. So for today, just be in that RPE. Maybe it'll be more weight than last week. Maybe it'll be less weight than last week. That's okay. That's normal. Just try and hit that range of RPE on a day to day.
Yeah, and I've personally noticed that it fluctuates with where I am in my cycle. So like if I'm ovulating, I might be able to lift more versus if I'm close to menstruation, I'm like, I can't do it. Like the same weight I'm going to struggle through that I wasn't able. And it also depends on where it is in the workout. Yes. So like if that machine was busy and I did something else, I'm going to come back and I'm going to struggle a little harder on that one.
Makes sense. I mean, starting with what you just said, like you just expended more energy. Yeah. On a different exercise, you like physiologically you used energy, and then also just the mental side. People discount the mental side of lifting, like it's a huge component. Mm-hmm. So if you expend more energy, and now it's later in the workout, and you're a little bit more tired, it's going to be more difficult. The muscles will be more fatigued already. In terms of the menstrual cycle, this is a huge debate in the strength world right now.
I know.
Huge debate.
Well, especially with the menopause space, but yes.
And there's research saying both. Surprise, surprise. Some research saying that it does affect it, and some research saying it doesn't. And for me, it's like, what you tell me. Like, right. If you've been strength training for this long, and you've been, your cycle, your body, like, then let's listen to what you're telling me. And if for some women are like, no, it doesn't fucking matter. It's the same every time. Other women are like, no, I'm definitely feeling better and stronger here. I have some female clients who are powerlifters who they very much feel better at certain times of the month. So if they're going to compete in a powerlifting competition, we'll make sure it's not going to be during a certain time of the month, because it would suck if I scheduled it at a time that they feel the weakest. Yeah. So it's very individual dependent.
I think that's in medicine too, right? We talk to patients and we give them the data that we have from studies and what we know and what the treatment options are. But like what works for this person is not going to work for that person. And it may not be my cycle. It could be something completely different that like that month happened and I just happened to notice that it mirrored my cycle. But regardless, right? Like it doesn't matter. That's how I'm feeling and that's fine.
Exactly.
Right?
And it's also, if it happens around the same time every month, there's a really good fucking chance that it's due to your cycle.
It's possible.
And like, just because the research might not show it yet doesn't mean that it's not true. Right.
It hasn't been debunked.
Exactly.
Right? I mean, not definitively by any means.
At all.
Yeah. So let's talk about, you said you hate burpees. Are there other exercises that are super popular that you think people shouldn't be doing?
This is something that I've really internally struggled with, because on one hand, I just want people to exercise. I just want them to move.
Yeah.
That's the most important for me. And when I hate on an individual exercise, it's less about the person doing it and more about the coach prescribing it, who has no idea what the fuck they're prescribing it for. And for me, people ask, like, how do you know if a coach is a good coach? it's impossible to know right away. You have to work with them to figure it out. But a good coach will be able to tell you exactly why they programmed a specific exercise at that point in the workout for that many sets and reps or for that duration, and they will not get annoyed at you asking them, and they can tell you exactly what it does and why it's there. If they can't tell you outside of it's going to make you tired, they don't know what the fuck they're talking about. And so I see coaches programming a lot of exercises that should not be programmed. I think the worst one of all of them is doing stuff on a Bosu ball on that especially when it's turned upside down and it's unstable. People get really mad when I talk about this. And I'll start by saying, before you get mad, go to the Bosu website and you will see on the website of Bosu, it says, do not use this upside down and stand on it. They explicitly say this. You might, well, why do they say that? So before you say it's not a bad exercise, the company itself says you shouldn't fucking do it. And why? Well, because they have been subject to so many lawsuits from people falling off. I was an expert witness in a case in 2012 or 2013 because a coach had their client, an older woman, standing on a Bosu ball, an upside down Bosu ball, doing fucking not just squats, but throwing a medicine ball at her and catching it. And it's it's good for balance. She fell off. And when I say she destroyed her knee, I mean she destroyed forever. ACL, MCL, PCL, meniscus, everything gone. Life completely altered as a result of it. And this is not a standalone case. Go on Google, type in lawsuits around people standing on a Bosu ball, and you will find that there's a lot of issues and a lot of injuries around it. And Bosu, thank God, has done the right thing and said, do not stand on this ball upside down. It is very dangerous. So vote, but props to Bosu for doing that. Can some people do it? Sure. That doesn't make it a smart exercise. It's still a very stupid idea. And Bosu, by the way, there are many great things you can use the Bosu ball for. But that specific one, standing on it when it's very unbalanced, is unbelievably dangerous. And the vast majority of people shouldn't be doing it. And not to mention, the main reason people will say it's good is because of balance. Well, let's talk about that. Let's talk about the science of balance. Yeah. Balance is demand specific. So what that means is if you're training on an unstable surface, then you are getting better at balancing on an unstable, wobbly surface. But how many times in your life are you on an unstable, wobbly surface?
Never.
Even ice is stable. It's just slippery, right? So when you want to train to get better at balance, you should train in a way that mimics what you do day to day, which is probably standing on the floor. Where do most people end up falling? Going up and down stairs, going off of a curb. So I don't know, maybe doing a step up off of a stable surface, doing a lunge, doing a step down. These things mimic what you do every single day and actually have more demand specificity than standing on a wobbly surface. The main people who might benefit from an upside down Bosu ball, and I'm not recommending it just like Bosu isn't, but people who surf for their sport, people who, if you work on a boat, I don't know, a boat might be people who work on a boat, on a fisherman's boat might be a good idea. But then again, you probably get all you need from your
being
job
on the boat.
and from surfing, right?
Yeah.
So it's probably not worth the risk of doing that. So standing on a Bosu ball upside down doing squats is one of the all-time worst, dumbest exercises for sure.